All right, so with your notes in front of you, the blanks, if you lose these or wreck these, you can print off from the website, mrmathwell.com. Right here are your notes, and this is the copy of the PowerPoint that I'm using to teach you today. So there's your notes right there if you need them. And PowerPoint. Okay, let's get moving here. And don't like these default settings. Duplicate. Excellent. Okay, anatomical directions, planes, and movements. Okay, so as we move through talking about the human body and about systems and about different things, we need to kind of have under control some of these technical terms. Okay, girls, you got paper? Yeah, right here. You can get one. Everybody has one, right? You have extra? Okay. I'll need that extra back probably, but you can bring that up later. All right, so anatomical directions. Okay, so forward, up, down. There's special terms for all this stuff. Planes. Do you know what a plane is? It's not like no, not like that. It's like slices of space. Okay, so there's a vertical plane. There's a horizontal plane. Right? There's different planes. So if you think about a plane through an object like this, that's what a plane is. It's a slice. It's a thin slice of space. All right, so what we'll learn in this lesson, this isn't in your notes here just yet, but we will identify and utilize anatomical positions, planes, and directional terms. We'll talk about the purpose of anatomical terms, demonstrate what anatomical position is and how it's used to reference the body, distinguish between the commonly used anatomical planes and recognize their individual views, apply directional terms to their location on the human body, demonstrate body movements, compare and contrast the various movements of the body and their counter movements, compare and contrast the various movements of the foot and ankle and their counter movements, and compare and contrast the lateral movements of the wrist and hand and their counter movements. All right. So, again, I don't think your notes have quite started yet. So here we go. Why learn these terms is where your notes should start. So the purpose of anatomical directional terminology. Anatomical directional terms are used to describe the relative location. So that's the location in which one thing relates to another, of the various body parts and structures in relation to one another. Okay? Understanding these terms is crucial for medical professionals, including physicians, nurses, and physical therapists, as well as for students of anatomy and physiology. So anatomy is literally just the parts of the body that we're going to be studying, today. Physiology is kind of like how all those parts kind of work together and where they're situated and what their function and stuff is. All right. By using these terms consistently, medical professionals can accurately communicate about the location of injuries, conditions, or other anatomical features, and ensure that everyone involved in the patient's care is on the same page. Otherwise, it's tough to see there, but it says, otherwise you get, oh, whoops, that was the wrong arm. You don't want the doctor to be operating on the wrong arm. Okay? And to make sure, it's not fun. It's not fun at all. Okay, anatomical position. Okay, standing erect means standing straight up and down. Okay, you're not laying down sideways, you are erect up and down, with palms and feet facing forward. This is the standard reference point in which all positions, movements, and planes are described. So you see a diagram here of this lady here. So that's the sort of the default position. So when we're talking about, distal and all this sort of terms, it's from this sort of standing position. We're not like this, we're not like this, right? We're not turned sideways, looking over our shoulder. This is a standard, okay? This is the standard sort of frontal view. Other species like horses and things like this, they have their own anatomical positions and planes, but the human body will start facing forward like this. So anyways, this you can look up this PowerPoint later if you want to study any of these diagrams, but we'll come across all this again. Okay? All right, anatomical planes. Let's take a look at anatomical planes. Fixed lines of reference along which the body is often divided or sectioned. Here's a diagram. You do not have this in your notes, but again, you can look this up on the website. The plane, just to describe the plane, as I mentioned before, a plane that goes sideways through your body would be this YZ plane, okay? The XZ plane would be this plane that goes right through, the front part of your body. That would be the XY plane. And, sorry, the XZ plane, the XY plane would be one that would sort of like cut you right in half, right, like this way, okay? So there's the planes. And yes, all of these terms, we'll talk about all of these terms one at a time, but here's a diagram that you may find helpful a little bit later. All right, fixed lines of reference along which the body is often divided or sectioned to facilitate viewing of its structures. That's what an anatomical plane is. It allows one to obtain a three-dimensional or 3D perspective by studying the body from different views. And yes, we'll talk about each one of these different kind of planes here as we move through. Okay, so it gives you a 3D perspective when you talk about the different planes. Okay, so the first plane we'll talk about is the sagittal plane. This plane dividing the body into left and right portions. Okay, so again, as we stand facing frontward, the sagittal plane is this plane that divides the body this way, right through the middle. Mid-sagittal or median are the names for the plane dividing the body into equal right and left halves. So we could have a plane that goes through, front ways, but off to the side here. We could have a plane that divides, your body exactly in half. That's the mid-sagittal. Often the one we'll refer to there, or we'll use a lot. And the parasagittal refers to the plane that divides the body into unequal right and left sides. As I mentioned, a plane that might, intersect through your heart, let's say, slightly on your left side right here. So that wouldn't be equal left and right. That's parasagittal. Okay, so you've seen maybe this kind of cross-sectional, view. This is like a human head, and this would be like a cross-sectional view halfway right through the head like this. And so you get half the brain. You can see some sinus cavity and spinal cord and the different structures in the face and nose and mouth and that sort of thing. So that's what a side view of this mid-sagittal median plane would be. Okay. Stop me if you have any questions, but like I say, just kind of we're going over just terms and stuff here, so stop me if you have any questions though. So the frontal or coronal plane, the plane dividing the body into front and back portions. The specific name, and again, when we're talking about anatomy and physiology, there's these names you're going to have to study. You put them on cue cards. Whatever you need to do, look them over, study diagrams if you're a visual person, use cue cards. If you're auditory, read it over out loud, whatever you need to do. So you're going to do your best to memorize all of these terms and what they mean. And you're going to take some time with these filled in notes once we've got this all filled in and be able to study. But the front is also called the ventral, part, and the back is the dorsal. You've maybe heard the word dorsal, like dorsal fin, right? Like a dolphin's dorsal fin, right? It's kind of their back main fin there, I guess. So the back is the dorsal, the front is the ventral. Okay. Okay, the transverse plane. Transverse is the plane, the horizontal plane, dividing the body into upper, and the upper is also called the superior. Okay, so superior is above, upper, or the cranial, where your head is on the top, cranial, and lower or inferior, and I think that's caudal, C-A-U-D-A-L, caudal positions. Okay, so inferior caudal. This is sometimes also called the horizontal plane. And you see some more, look at this little cross section there. That is a transverse plane right through the eyeballs. Right about here. So those are the eyeballs there, and your brain, your spinal column in the mid there. Okay. Yeah, this little slice here would be like the the abdominal sort of transverse slice. All right, anatomical positions and directions. Let's move on to this part here. Okay. Okay, the terms of position and direction describe the position of one body part relative to another, usually along one of the three major body planes. We will look at them in pairs of opposite terms, okay? In pairs of opposite terms. And you can see from this diagram some of the terms we're going to be studying. Obviously, left and right is pretty straightforward. We use that all the time. When we're talking about distal and proximal, those are terms that you might have heard before. Now, we just heard superior and inferior, right? So superior would be up and above and so on. So can you look, see what's common with the distal arrows here? This distal looks like it's going down. This distal looks like it's going down. Proximal, okay? Medial, lateral, interesting. That has to do with the center line. Let's take a look at each one of those individually. Okay. Anterior. Okay. Anterior refers to the structure being more in the front than another structure in the body. So if something is anterior, it's in front of. Okay? It means in front of. Posterior refers to the structure being in the back. Okay? Than another structure. It's behind. Okay? And your posterior, sometimes your butt is referred to as your posterior. Have you ever heard any terms with that before? But that's your behind, your butt, your posterior there is as back as you can get, right? So posterior. So the face is what to the occipital lobe? The face is to the or to the brain is anterior. Yeah, that's anterior. And I don't know why that's not filled out, but so anterior is in front of. Good. Your brain would be kind of posterior to your nose, let's say. Awesome. Okay. Next, please. Superior refers to the structure being closer to the head or higher than another structure in the body. Okay, your shoulders are superior to your hips or your pelvis. Inferior refers to a structure being closer to the feet or lower than another structure in the body. So you see that over on the side here, superior, as you go away from the middle or whatever, away from the bottom, you go higher, you're getting superior, and then inferior. So the neck is what to the head? Inferior, right, below. So this should be inferior. Now you have that as a blank as well, right? Yes, the neck is inferior to that. Excellent. Oh, wow, look at that. Okay, so, oh, I see. So yeah, so there we go. The words come up there. Yes, that's right. Okay, I was wondering why they weren't filled out, but looking ahead. Okay, medial. Now look at the diagram. Medial has an arrow towards the midline. So this refers to a structure being closer to the midline or the median plane, right? Or the mid-sagittal plane of the body than another structure of the body, medial. Okay? Lateral refers to the structure being further away from the midline than another structure. So lateral movement is side to side, right? Lateral movement. So we're talking about the sides, closer to the sides. Medial, closer to the midline, or median, closer to the median. Okay, so the deltoids, those are the shoulder muscles right here. They are blank to the spine. What do you think? The spine is in the middle. The deltoids are what? Lateral. Lateral to the spine. Very good. Okay, any questions so far? You guys, this is a lot of information. I know. You don't have to have this all memorized by noon. Okay? But this is something that you will be studying, and you will have to learn these terms. Okay? So hopefully it's making sense so far. All right, positions and directions. This is reference to the extremities or the appendages only. So your arms and your legs kind of thing. All right? So think about that. So distal. Distal refers to the structure being further away from the root of the limb than another structure in the limb. So the root of the arm would be probably the shoulder, right? So as you move away from the shoulder, these parts of the body are distal to the shoulder. Proximal means closer to the root of the limb. So if your limb is your leg, your hip up here would be the root of your leg. So proximal would be closer to the root of the leg, not closer to the end. So in the example here, the phalanges, that is the finger bones, your finger bones, are blank to the carpals or the wrist bones. What are they? They are proximal or distal. The phalanges compared to the wrist bones. The phalanges are, yeah, it's not working. Distal to the carpal. So distal is more in the end. So these are distal to the wrist bones. They're further away from the root. Yeah. Yes, think distance. There's further distance away from the root of the arm. Yeah. Yeah, that's all right. Let's get it straight. That's all right. You're probably gonna get things mixed up here once in a while. It's no problem. Okay, so distal, proximal. When you divide the skeleton into axial, okay, so look at this diagram, into axial blue, that's kind of the central bone structures, the spine, the rib cage, the neck, the skull, and appendicular, the yellow portions of this, appendicular, you can better understand the extremities and their roots, okay? So again, the pelvis is the root of the legs, the shoulders are the root of the arms, and whatnot. Anything closer to this blue region, is proximal, right? It's closer to the mid, proximal, closer to the mid. Yep. Quickly. Okay, so axial, blue, appendicular. So appendages, right? That's like your arms and such, appendages. All right. Okay, positions and directions. Oh. Question?
Yeah, our blanks are like...
Are your blanks a little bit different? Let's see. Are they missing some? So axial versus appendicular. Okay, so the head, neck, and the trunk, what are those?
Axial.
Those are axial, yeah. So axial is the blank that you put in there, head, neck, and trunk. The appendicular is the appendages or limbs. So axial is your first blank, and appendicular is the second blank. Okay, good, got it? So those are the separations or the divisions of the skeleton. Axial is kind of like the core, and appendicular are the appendages, basically. Good to go? Okay, cranial or cephalic towards the head. Okay, cranial, that's on your next page there. Okay, cranial towards the head. That makes sense. Your cranium is your head. Caudal towards the tailbone. Okay, so cranial and caudal. Make sure you get those ones figured out. And like I say, you know the cranium is your skull, right? That's your head. So that should be easy to remember. All right, more on positions and directions. Superficial refers to the structure being closer to the surface of the body than another structure. So a superficial wound is very close to the surface of your body, right? A superficial wound, that's a scratch or a cut. So closer to the surface. Deep refers to a structure being closer to the core of the body than another structure. Okay, that makes pretty. Superficial is surface, deep is inside. Yep.
The slide before was not anatomical position.
The cranial and caudal? Yeah, it's head and tailbone. Right?
But usually you said it's supposed to be anatomical position.
Are you asking about this this slide right here?
He's asking about the picture.
Okay.
It's not like
said the anatomical position is supposed to be like erect, facing towards. Like she's not erect, that's what he's saying.
That's correct. Yeah. Yeah. That's right. She's not erect. Yeah.
Why? He's asking why isn't she erect?
Oh, like why isn't she in that like starting position?
Well, okay. So these terms apply. These terms apply to any position, right? So cranial is the direction towards the head. If she was standing upright, like in the original diagram, then the arrow would be pointing up towards the cranium. It's just another way of looking at it, right?
Does it necessarily mean up or down?
It does. Yeah, it doesn't mean up or down. That's the whole point. Yeah, it means towards the head or towards the tailbone. Yeah. Okay. So the epidermis, that's the outer skin layer, is what to the skeleton?
Superficial.
Correct. Superficial. Okay, superficial and deep. All right, positions and directions. What about ventral and dorsal? Ventral. Ventral is towards the front or the belly part. Ventral. And dorsal is towards the back. So ventral and dorsal, where are we there? So your blanks are front and back. Okay, so where's the thoracic cavity here? The thoracic cavity. You see it on the diagram? Kind of your chest, right? Thoracic cavity where your kind of your heart is and up there. So that is what to the spinal cavity? Yeah, it's ventral. It's towards the front, closer to the front. Okay, this making sense so far? Yeah? Okay, you guys doing great. All right, positions and directions. Let's talk about prone versus supine. Prone and supine are terms used to describe someone when they are not in the anatomical position. These terms are useful especially in forensics. So there is a difference between prone and supine. Prone is lying face down. So your chest is touching the ground kind of thing. Supine is lying face up. Okay, prone, face down, supine, face up. All right, unilateral versus bilateral, and ipsilateral versus contralateral. So unilateral, pertaining to one side of the body, uni is one, right? Pertaining to one side of the body. Bilateral, pertaining to both sides of the body. Bi is two, bilateral. Lateral sides. One side, two sides. Ipsilateral, when two parts are on the same side of the body. That's ipsilateral. And contralateral, when two parts are on the opposite sides of the body. So your arms are bilateral, but your left arm is contralateral to your right arm. Okay. Okay, the lungs. The lungs are blank to each other, which makes them blank. They are... Okay, they're opposite, but which one of these four terms might go in there? The lungs are blank to each other, which makes them blank.
Contralateral and then bilateral.
Opposite is contralateral. So if you said lungs are opposite to each other, yes, but they are contralateral. That's the term that we would use. Which makes them what?
Bilateral.
Bilateral.
Are those two interchangeable? Like in the blanks, would they be interchangeable?
No, these would not be interchangeable. No. The lungs themselves are bilateral organs. So they're one on each side. This, the lungs, in reference to themselves, one is on one side and one is on the other side, so they are contralateral to each other. So they're close, it's close, yeah, but not interchangeable in this sense. The ascending colon, so first of all, what does ascending mean? Going which way? Going up. The ascending colon is blank to the appendix.
Where's the appendix?
Where's the appendix?
I don't know what you
Is it at the top of the colon near your stomach, or is it down below a little bit more?
Isn't that the back of the butt?
Okay, oh, this is out of place. That's not supposed to be there. Oh, they all disappeared, cool. Wow, it's actually too far to the right over there. Ipsilateral, so when two parts are on the same side of the body, the ascent, now, if you didn't know that, that's fine, I don't have a diagram here. The ascending colon and the appendix are on the same side of the body. So you'll see I don't have a diagram here, right here, but they would be on the same side, so the ascending colon and the appendix would be on the same side. So that word is ipsilateral. Sorry, it's a little out of place there. Okay. I have this diagram here for you. It's not in your notes. This is on the website, and obviously it's here in the PowerPoint. So here's just a summary with a lot of the terms we've studied so far. In your textbook, how many of you have your textbook with you? Okay, so you'll be able to find some diagrams like this in your textbook as well. So we'll maybe pause here, take a second to look at our textbook, and I'll answer a couple questions if you have them. All right, let's keep going. Anatomy and physiology. Display settings. Come on. Okay.
I'm there. Like there's a diagram. Yeah, I see that.
All right. Now, so chapter 6 in your textbook will have a lot of these diagrams. The body systems that we're going to be studying, we have to know these terms kind of first before we can talk about body systems and where things are placed. Body movements, these are not necessarily going to be, you're not going to be necessarily quizzed on these so much, but some of these terms like flexion, extension, lateral flexion, rotation, some of these sort of terms here would be good for you to kind of know. Again, although you're not going to be tested on them, but body movements are what we're going to take a closer look at here now. All right. So these are some of the words that you'll be studying a little bit. Okay, so movements, we're talking about, moving your legs in and out, rotating your legs, folding, bending, that kind of thing, even shrugging your shoulders, okay, stuff like that. So again, in chapter 6, those of you that have your textbooks here with you, can you check in chapter 6 to see if you have a body movement section that we can outline here? Yeah. I'd rather you not, unless it's an emergency, because we don't have a lot of time here. So, yeah, just if it's an emergency. What page is that on? Okay, page 148 in your textbook has a small diagram of some of the movements. This is where your notes pick up, so we'll move here quickly again. Don't have a lot of class left, so we want to try and get through these page notes here. So flexion, okay, flexion versus extension versus hyperextension. So bending a joint or decreasing the angle between two bones is called flexion. So bending a joint where you are decreasing an angle between two bones. So if I'm going to fold my elbow down, I'm decreasing the angle between these two bones that that extend from the joint. So that's a flexion. An extension is straightening the joint or increasing the angle between the bones, okay? So I'm moving away, this is an extension, which makes sense. If you extend your arms, right? Basketball, right? Your basketball, if you push someone away, you're extending your arms, that's a foul, right? Okay, so that kind of thing. So flexion, extension, hyperextension, and you've probably heard of this with your knee or elbow or whatever. This is an excessive extension that goes beyond the sort of typical anatomical position. So your elbow is meant to bend this way. If you bend your elbow at the joint the other way, that's a hyperextension of your elbow. Yeah, you'd probably be injured. So a flexion for your hand, let's say your hand is coming down towards your wrist or your arm bone, that's a flexion. Extension would be going upwards. Hyperextension would be going beyond sort of the typical rest anatomical position. So your hand, you can hyperextend your wrist here too technically. Now, it's a little bit more difficult with your hand because this is decreasing angles between bones, just like this is, but elbow is better. So flexion, extension, hyperextension. Yep.
When we do flexion, is that some part, is that we did just describe the whole elbow is extension or flexion, or some part of the, no, like just.
Yeah, I wouldn't worry about it. It's based at the joint, I guess.
When you bending, this angle decrease, this angle increase.
Yeah. I see what you're saying. Yeah. So this would be a flexion if it's the normal movement. That's a hyperextension. So that's not a flexion if you're going back up like that. This is a flexion. This process of going this way is an extension, and then beyond this position would be. Okay. Yeah, that's okay. That's okay. Ask me later. Lateral flexion. Okay, let's keep going. Lateral flexion. Side bending, left or right. So here's a picture. You move sideways like this. A good stretch for your abdominal muscles there, but that is a lateral flexion. Adduction. Adduction. Moving a body part towards the midline of the body. Think adding to the body. Okay, think adding to the body. So adduction, if you think about your hands like this, or your arms coming down even, right? Your fingers coming together towards the midline of a structure or your body you're adding to. Abduction is moving the body part away from the midline of the body. Abducting it from the body, taking it away from. So again, your arm, abduction, going away, adduction, coming towards. Add, coming towards the middle, abduction, taking away from the middle. Okay, pronation, turning the arm or foot downward, palm or sole of the foot down. Okay, so if you have your arm off to the side like this, if you move it down, okay, down like that, pronation. Supination, I'm not sure that's supination or supination, but the supine, supination would be going upward. Okay, so upward. Pronation, supination. Some of these are really close to being the same, right? So some of these are specific to body parts that you hear these used, but supine is laying down face up, right? So supination, turning the arm or foot upward, palm or side of the foot upward. All right, retraction. Retraction, moving a part backward. Retraction, moving a part backward. To retract. If you retract a statement, that means you take it back. Okay, so backwards. Protraction, moving a part forward. Okay, if your jaw is forward on your bottom, we call that prognathic. Okay, pro means forward. Moving. So protraction is moving forward, retraction, moving backward. So in this example here, the lower jaw, retract, going back in, protract. Elevation is raising a part of the body, so your jaw comes up, that's elevation. Depression, going down. So this is elevation of the mandible, that would be like your jawbone there, and depression, going down. Okay. Rotation, turning on a single axis. Okay, so if you're rotating your head, you all know what that means. You're rotating it on a single axis of your spine there. Some of these words are a little bit funny here now. Circumduction. Circum, think about a circular motion. Okay, circular. A triplanar circular motion at the hip or shoulder. So you think about, this. So if you move your arm out like this, I guess that would be the circumduction, circular motion at the hip or shoulder, circumduction there. External rotation, rotation of the hip or shoulder away from the midline. External rotation of the hip or shoulder away from the midline. So if this is your midline, right? If you turn your shoulder in, right, that's an internal rotation. External rotation would be away from your midline, okay? Or moving your arm away from your midline, rotation, okay? So external is outside or away from, internal toward. Okay, doing great, guys, doing great. Only got a few more slides left here. So movement of the foot. Oh, this is interesting. You don't talk about the movement of your ankle or your foot very much. So an inversion, okay, to invert, the inversion is turning the sole of the foot inward. Here's a diagram here. Turning your sole inward is an inversion. An eversion is turning it outward. Eversion. In towards your midline, eversion away from. Dorsiflexion. Okay, so remember, flexion is moving your the angle between your bones is getting smaller. So a dorsiflexion, okay, is your foot coming up, right? If you pull your toes up, that's dorsiflexion. Again, some weird words you probably never heard before. Plantar flexion is pointing, going down. So, like plantar warts on the bottom of your feet. Think about that. Plantar warts. You have warts on the bottom of your feet. Plantar warts. You're going down towards those. Okay. Dorsal fin is kind of like your back, so you're coming up towards your back. I don't know. However you want to remember that. Dorsiflexion, plantar flexion. All right, movements of the wrist and thumb. Okay. Radial deviation. Radial deviation. Movement of the wrist towards the radius or lateral side. Okay, so now the radius, okay, that's the inside bone of your arm here. Okay, so the radius and the ulna are two bones in your forearm. So radial is inside, your thumb coming towards, your thumb coming towards, okay, and then that's radial deviation. Ulnar deviation is your thumb going away. Okay. All right, both deviations when you wave. Okay. So movement of the wrist towards the ulna or medial side, ulnar deviation. Opposition, movement of the thumb across the palm of the hand.
Hunter Maxwell. Sorry.
Nice.
Can you wait like 5 minutes here or what? What do you need him for?
Huh?
What do you need him for?
The picture of our team.
Okay. Yeah, I guess you go. Go now then. Yeah, go. Hurry up. Go. Opposition. Movement of the thumb across the palm of the hand. So you've heard of opposable thumbs, right? Opposable thumbs. Okay, so we have opposable thumbs, which makes grasping and holding onto things very neat. Nice how we were created to be able to do that. So opposable thumbs. Your thumb bends towards, the opposite way that your fingers do. Okay. So, is that the end of your notes there?
Yeah.
Okay, good. Okay, good. Let's just check. What time is it here?
We have like a minute or two.
Okay, let's.
We have 1 minute. And we don't have.
All right. So, guys, okay, listen up carefully. Listen up. Okay, it's the end of your notes package. So you guys now have this notes package filled out. It's your job to study it now. So you have to study these new terms. Look in your textbook in chapter 6 for diagrams such as this one. There's going to be lots of little terms that we're going to be moving through as we study the systems of the body. Okay? So that's the end of your notes here today, and I will show these two slides. Remember that's your ethics assignment. That'll be handed in on your quiz on Friday. You have a quiz on Friday. Okay, get out of here. See ya.
Mr. Maxwell, one question.
This way. This way.